guys, we're going to go over the answers for 3 patients, 1 symptom. Week 1 was shortness of breath. Before we get started here, disclaimer is we are nurses, so we don't technically diagnose. We're using this educational video learning to enhance our critical thinking skills. Patient number 1, the diagnosis was anemia. As you know, anemia is the lack of enough healthy red blood cells to carry oxygen, leading to fatigue, weakness, pale skin, and shortness of breath. The clues that indicated this diagnosis were preoperatively the black stools and the paleness that was noted. Postoperatively, the significant blood loss. Low SATs consistent with anemia due to the lack of the healthy red blood cells to carry oxygen. We would expect a blood draw to check the hemoglobin and hematocrit. If low, that is a definitive diagnosis of anemia and possibly needed a transfusion. Patient number 2 diagnosis on the pre-op side is fluid overload. Fluid overload is too much fluid in the body, often from the heart, kidney, or lung issues causing swelling, weight gain, high blood pressure, and shortness of breath. The clues that indicated this were the history of CHF, the weight gain, and then the lung sounds requiring oxygen. I would expect a chest x-ray for a definitive diagnosis and maybe an order for diuretics to treat. Patient number 2, diagnosis on the PACU side is residual muscle weakness. At the beginning of surgery, medication such as a paralytic is given for intubation and sometimes repeated throughout surgery to relax the muscles. At the end, usually medication is given to reverse the paralytic so the patient can effectively maintain their airway and breathe on their own. The clues are the shallow, fast respirations trying to use the accessory muscles. The lack of medical history and clear lungs rule out lung disease such as COPD, asthma, or CHF being the cause of shortness of breath. The treatment I would expect for this patient on the PACU side is either more reversal that was already given, or if reversal was given, maybe trying a different reversal medication. Patient number 3 diagnosis is anxiety. Anxiety can manifest in a lot of different symptoms. The lack of medical history and clear lung sounds seem to indicate there aren't any lung disease. The clues are the circumstances of being a trauma after a motor vehicle crash, worried about the boyfriend, and generally overwhelmed. Treatment would be making sure that the pain is under control, and obviously maybe some medication like Versed or a like that is received from or obtained from an anesthesiologist.